Hello, this is my female intermittent urinal catheterization video. I am going to start by gathering my supplies. I have my gloves, my sterile gloves, my catheter kit, hand sanitizer, and I am going to pretend this is Perry wipes. So I am going to start and verify my provider order. So my patient is Renee Adams, no known allergies, May 25th, 1978. Provider orders intermittent catheterization. If patient has not voided within 4 hours, use bladder scanner to check bladder volume. If volume is greater than 200, then perform intermittent urinal catheterization. My patient has been complaining of not being able to void. I perform the bladder scan and bladder volume is 400 mLs. So I am going to go ahead, go to my patient's bedside. I'm gonna knock in the door, clean up my hands. I am going to close the door for privacy, and I'm gonna introduce myself. Hello, Renee. My name is Michelle. I'm here to do a urinal catheterization on you. I know you have been complaining of not being able to void. We did a bladder scan, and you have a volume of 400. So I am going to go with a tube, and I am going to introduce the tube into your urethra, and I am going to remove that urine that you have in your bladder. So I also gonna perform perineal care before I catheterize you. Is that okay? Patient stated yes. I am going to wipe my hands, and I am going to identify my patient. Renee Adams, May 25th, 1978. Renee Adams, May 25th, 1978. This is the correct patient. So Renee, I am going to please ask you to spread your legs, bend your knees and spread your legs wide open so I have access to your private area. I'm going to wipe my hands. Put on my regular gloves. Uncover my patient private area with my Perry wipes. I am going to clean farther away from me, front to back. Dispose that in the garbage. Closest to me, front to back. And lastly, in the middle, front to back. Once I do that, I'm gonna remove my gloves, clean up my hands, and I am going to check for my kit. Make sure it's not expired. It's not expired, expired January 2024. Remove the packaging, clean up my hands. Cleaning up my hands. I'm going to open the kit away from me. I'm gonna put this, and I'm gonna ask my patient to lift her hips. Patient lift the hips. Now I am going to clean up my hands. And I am going to proceed and put my sterile gloves. I want to make sure I don't touch the inside of the glove. Now I can touch the inside of the glove. I am gonna go now and open up my swabs. Open up my lubricant. Lubricant tube. Now I'm gonna bring this closer to my patient. With my non-dominant hand, I am going to dirty it by opening up the labia. And I am going to clean up my patient. I am going to clean up away from me first. Close to me now. And now in the middle. Once I clean, I am going to introduce the catheter into the urethra until I see urine flow into the tube. Once I see urine flow into the tube, I'm gonna advance like 3 centimeters more. I am going to hold it in place until the end of draining. Once I finish draining, I am going to remove it. You're gonna feel a little pressure coming out, Renee. Once it's out, I am going to grab the bag and I'm going to clean up the area of my patient. I'm gonna dispose my garbage. Remove my gloves. Cleaning up my hands. Providing my patient privacy by covering her up. Clean up my hands. And document how the patient tolerated. Thank you.